Hello, my name is Lucy Zielinski, and I'm managing partner of Lumen Health Partners. And today I'll be talking about increasing pneumococcal vaccine rates for medical groups. And I'll be talking about the quality improvement process around these PV rates. So the agenda for today, we'll talk about why increase the rates. I'll introduce you to a quality improvement process, including a PVSA case study. And then I'll talk about what are some of the best practices that I've implemented and have seen other practices successfully implement as well, tactics to increase those PV rates. And then overall, I'll talk about the project timeline and next steps. So the goal of our project is really to increase the PV rates in patients 65 and over, and those with chronic conditions, including diabetes, and for those patients who smoke. So why increase PV rates? Well, first of all, better care. Don't you think that's a great reason? If you take a look at some of the statistics, they're pretty alarming as far as the mortality rates and the volumes of infections that pneumococcal infections are responsible for on an annual basis. It's over 1 million. And then 69% of adults 65 and older received a pneumococcal vaccine. So there's a third, if not greater, of patients who have not received a pneumococcal vaccination. The second reason to increase PV rates is sustainability for your medical group and your public reputation. If you think about what's occurring in the industry today, there's this transition to value-based payments. So the models of payment are changing from just getting paid for services to getting paid for value or the outcome. So decreasing that medical spend and some of the complications due to non-vaccination is very important. And those scores are being publicly reported. Medicare and other plans, commercial plans, are reporting performance. And then the last reason is the revenue, because as I mentioned earlier, a lot of these value-based programs are tying in some incentive payments for quality scores or quality performance with certain measures. And then you have an opportunity for shared savings if, in fact, there is a decrease in medical spend for complications of chronic conditions or even non-vaccination. So those are some great reasons to increase PV rates. Let's talk about the quality improvement process. Where do we start? Well, first of all, in your practice, you want to establish a culture of quality. So focusing on quality, and then identify areas for improvement, determine what data collection methods you're going to use, and then establish target goals, right? What are we measuring? And then how are we measuring against our goal? And then definitely sharing the results and then committing to ongoing improvement. So this really never ends because there's always an opportunity to improve. One of the other important things in the QI process is creating an aim statement. So what's an aim statement? An aim statement, it's a clear way or summary to describe what your team hopes to achieve over a certain amount of time and the change that will be required to achieve the results that you set forth. So your team will need to create an aim statement before you even start the project. So the specific measure which you are using in your project will need to be identified. The baseline data for that measure will need to be identified. And then the date for which the goal will be accomplished will need to be identified as well. So I listed all the questions here that an aim statement typically addresses. So let's for a moment think about PV rates and what would be a good example of an aim statement. So one thought I had was an example would be for your practice, such as this. We will increase our PV rates for our Medicare patients 65 years and older by 5% from our current baseline, which is at 52%, by October of 2019. So as you can see, we answered all of the questions. What, by when, for whom, and how much. So aim statements are definitely important and a great way to start any QI project. So one of the constructs that I typically use, and we've used in many other QI projects, is the Plan, Do, Study, Act, or PDSA as we refer to it. So the Institute for Healthcare Improvement created the PDSA cycle. And the first question that's often addressed is, as you can see at the top there, what are we trying to accomplish, right? So defining that is important first. And then how will we know that a change is an improvement, and what change can we make that will result in an improvement? So the PDSA cycle starts out with plan. So first you need to develop a plan to test the change. Secondly, the do, you have to carry out the test or your plan. And then 3, study it, right? Observe and learn from the consequences. And then 4, act. So determine what modifications need to be made to the plan and modify it. And then start all over again. So here's an example, a PDSA example on improving PV rates. So number 1, let's identify our problem. Well, in this situation, we had low PV rate. We had lack of availability of appointments for patients to come in a timely manner. And the wait time at the office was just too long. Patients were used to waiting a half hour plus. And so that deterred them from coming in. So we thought that was the reason why our PV rates were low. So number 2, what did we decide to do? Well, in this case, we said, let's go ahead and have a protocol where we would do a walk-in clinic for immunizations, for pneumococcal vaccinations. You could also do this for flu and other vaccines as well. So we implemented the walk-in clinic, advertised it via the portal, put some notices in the offices and such, and then had our care management team do some outreach with the patients who have not had APV and ask them to come in to our walk-in clinic to go ahead and get the vaccination. So we did that, implemented that, and then over a period of 9 months, our PV rate increased 20%. We were tracking it all along, monitoring it on a monthly basis, and at the end of the 9-month period, we saw an increase of 20%. So we said, gosh, that was some great progress. So number 4, we looked at the solution, and we thought, gosh, we're going to keep that walk-in clinic. It produced some great results. And then also we decided to expand the hours on weekends because we didn't have any weekend hours. So we decided to expand those on weekends to even increase that PV rate even higher. So this is an example of a PDSA cycle as it relates to PV. This is something that all of you can be doing in your offices and will be as part of this project. So before we get into some of the tactics, let's kind of break down the quality measure. So we have here the pneumococcal vaccination status for older adults. And if you want more details as far as the numerators, denominator, the definition, or the specifications of this measure, I included the link at the bottom of the slide. You can go to the QPP website and search on the quality measure for the details. But in this case here, I just listed the definition there. So they define it as percentage of patients 65 and older who have ever received a pneumococcal vaccine. And the calculation, the numerator is patients who have ever received a PV divided by the patient 65 and older with a visit during the measurement period, which is typically a year. and that results in your PV rate for your practice. And as you can see there in the table below, what I ended up pulling here is from some of the MIPS data, the EHR results that were published and are available on the QP website. The average for practices is pretty low. It's about 51% overall. So this is a good comparison you can use to see where you land on the deciles as far as the MIPS past performance. So if you're scoring obviously below that 80th or the 90th deciles, right, below that 78%, there's definitely an opportunity here for improvement. So that gives you an idea where you land compared to your peers. So I won't go through too much detail, but as you can see here, I listed the coding, the CPT and ICD-10 codes for PV. So you would be using 90670, 90732, because we have those two vaccinations, the PCV13 and the PPSV23, and then as well as the administration code, G0009. And with those, the diagnosis code would be Z23 and counter for immunization. And based on Medicare policy, I have the frequency there. So more information can be found there on the link below. You can look at the MLN document, and they have a nice PDF for immunization and what's covered for Medicare patients. So what are some of the best practices to increase PV rates? Well, we definitely focus on people, process, and technology. And people that are involved are not only your providers, but your patients, staff, public health departments. The processes involve care protocols, some of the assessments, tools, even access, right? Having access for patients to come in and receive the immunization. And then lastly, technology. Technology, having electronic health record, which I'm assuming all of you have one now. Sometimes practices use registries. And then what's important is the ability to report and have analytics around the PV rate. And then lastly, sharing some of that data with other providers, right? That's important as well. So I'm going to take each of these sections and then talk a little bit about what are some of the tactics. So let's go ahead and start with people. What are some of the objectives, and then what are the tactics? Well, under the people section, you definitely want to increase your patient education and outreach. And what are some of the ways you can do that? Well, you can run a vaccination campaign to increase awareness. You can promote some educational material via patient portal or provider messaging, or even let patients know that they have not received a vaccine during that given year. A great opportunity to do this is during your annual wellness visits or the annual preventive care visits as well. And one of the other tactics is to think about those patients who refuse vaccination and how you're going to handle that. And then lastly, depending on your contract with your payer, you want to make sure you're compliant. But is there an opportunity to reduce any out-of-pocket costs or patient incentives that you could give them for coming in and be vaccinated? And then the second objective here is to enhance provider and staff awareness as well. And the tactics are listed: ensuring staff has the competencies, and then providing some sort of incentive or motivation strategies to increase the PV rates in your practice. And this doesn't always have to be money. I mean, it could be just a scorecard and an hour off or a party of some sort, but just to acknowledge the success and celebrate it with your staff and your providers. And then one of the others is to make it easy for your providers, right? So implement some reminders or alerts in your system, and then develop referral relationships with specialists. So specialists who realize that patients have not been immunized, that they can refer them to you, and making that easy. So now let's talk about the process. One of the objectives is to use evidence-based protocols. Taking a look at the ACIP and CDC recommendations for those protocols, and for practices to create standing orders, right? Standing order for PVs, so that other ancillary providers can go ahead and act on those orders. And as I mentioned earlier, incorporate the immunization needs assessment into all of your visits, especially during your annual wellness visits. But it could be any visits, your sick visits that patients are coming in for, checking the rates, so that's important. And then involve your entire care management team. So not only your providers, but your medical assistants, your nurses, your front office staff even, as patients are checking in, as well as any care managers or care navigators that you may have. So making this an initiative that involves the entire care team. And then the second objective would be to address the external access barriers. And we see this quite a bit with PV. You want to make sure that you have a plan to decrease the disparities, especially with your homebound patients, or if it's a cost issue, is to address some of those barriers to care. And then you want to promote, if there's any community-based programs, partner up with your community and promote awareness and some of the benefits of PV. And it also may also give you an opportunity for marketing and increasing your patient base as well, for patients to come to your practice. So lastly, let's look at technology. One of the objectives is to definitely use what you've paid for, right? Leverage that technology, the investment you've made, especially in your electronic health record. So you want to make sure your templates are built where the PV rates are incorporated, and then creating some alerts as well. You want to make sure you integrate it with the pre-visit appointment scheduling and confirmation processes. So start early so that your staff can communicate that with the patients, and the patients expect that when they come in, so they're prepared. You want to streamline the data flow and improve the collection process. So most of the EHRs are really good about capturing the quality measures. So make sure that definitely is on, if you will, in your EHR. And then some practices have a registry that they use to supplement some of the EHR data as well. And then you want to make sure you share the data with all providers within your network, so they know and everybody's working towards that same goal. And then lastly, in technology, you want to improve the reporting process, making sure that your providers are capturing those quality measures, the PV rates, and then sharing the results of those the rates using provider scorecards. And then establishing and comparing those scores to goals that you set forth. And then giving providers timely feedback so they can go back and look at the data and understand what patients did I see last month that I should have said something to that I didn't. So the sooner you can give the data, the better I think the rates would be. And then lastly, take a look at your past performance, your MIPS past performance feedback report, see how you did in previous years. And make providers aware of the historical performance rates and show them how they compare to other providers. Because if there's one thing I know is providers are pretty competitive and they really want to score in that top decile, especially when it comes to something simple as PV vaccination. So now let's talk, now that we've talked about some of the tactics, let's talk about the whole QI project we have here in front of us. So here's the process we're going to follow. First of all, engage all of you via this webinar, and then we're going to have 3 learning sessions. And I'll talk about those in a moment here. You're going to be using technology and tools, your data from your EHR, as well as PDSA worksheet. And then we're going to collect the data using a simple Excel spreadsheet just to track the PV rates from quarter to quarter. And this is what our timeline looks like. We're going to start out with month 1, right? Onboard the practices, have the meetings, grab some of that baseline data. What are your PV rates today? And then in the 2nd to 3rd month, we're going to schedule the learning session, and you will be implementing your PDSA, and then we'll pull at the end of that 3rd month your data, your PV rates, to see hopefully the improvement. And we'll do that again at the 6-month mark as well as the 9-month mark. And then at the end of the project, we will report the progress and discuss the best practices with the practice champions and finalize the report. So here's an example of the PV tracking sheet, pretty straightforward. We'll identify all the practices, your baseline PV rate based on the measure we identified above, and then track that from quarter to quarter. So what are the next steps? We're going to have these 3 check-in sessions. The first one will be on-site support of the QI plan design and the intervention plan, your PDSA plan. And the second one will give you feedback. And then the third one will be discussing the process results and what have we learned, right? It's that whole PDSA cycle. So we'll be with you along the way. So I'm really excited about this project, and I hope all of you are as well. I think this definitely helps support a lot of the work that I'm personally doing in the healthcare space as it relates to transformation of care delivery and just providing better health to patients. So I'm really excited about that. But just want to encourage all of you that it's the baby steps that really matter. And I love this quote by Brian Tracy. It's that excellence is not a destination, it's a continuous journey that never ends. So I would encourage you to start with something, take a baby step, and I think you'll see progress. And if you don't, start off at the beginning and try some of the other different tactics. So I'm happy to be part of this project and look forward to working with all of you. Thank you very much.